Hello, Dr. Brazier here. Welcome to this presentation on Dialectical Behavior Therapy, or DBT for short. Let's go. DBT was developed in the late 1980s by Dr. Marsha Linehan and her colleagues when they discovered that CBT alone did not work as well as expected in patients with borderline personality disorder. The primary goals of DBT are to help people live in the moment, develop healthy ways to cope with stress, regulate their emotions, and improve their interpersonal relationships. DBT incorporates a philosophical process called dialectics. So dialectics is based on the concept that everything is composed of opposites, and that change occurs when there's like a dialogue between two opposing forces. So with regard to dialectic, the task is to work to resolve the apparent contradiction between self-acceptance and change in order to bring about growth. Primary tenets of this include the idea that all things are interconnected, that change is constant and inevitable, and that opposites can be integrated to form a closer approximation of the truth. In practice, DBT has 4 separate mandatory components, at least for the evidence-based part of it. So the first is a weekly psychoeducation group in which clients are taught behavioral skills by completing homework assignments and role-playing new ways of interacting with others. The structured groups often are offered in mental health agencies and in partial hospitalization programs. And DBT covers 4 skill sets with a focus on affect regulation, mindfulness, interpersonal interactions, and distress tolerance. This approach encourages clients to stay in the present, to pay attention to what's helpful. It can aid in decreasing anxiety levels and self-destructive behaviors like self-injury, which can then assist in decreasing the overreactive responses often displayed by this particular population. So here's a resource that can be used to help people decide how to cope when they feel triggered. Options can include distraction, grounding, emotional release, self-love, thought challenging, and accessing your higher self. So this includes a description of each of these coping strategies, also then a list of potential pros and cons for each. The second component is individual therapy conducted with a trained professional where a client's learned behavioral skills are adapted to their personal life challenges. And then the third component is phone coaching. So clients can call a counselor from the group between sessions to receive guidance on coping with a difficult situation that they're currently in. So counselors then share call amongst themselves so that no single counselor gets burned out by having to be available 24 hours a day, 7 days a week in order to field these sort of crisis calls. And then the fourth and final component is a consultation team. All counselors in the group practice meet together consistently, and these meetings help therapists cope with the emotional demands of treating clients with challenging behaviors like self-injury, accusations, and suicide attempts. Consultation teams also help therapists navigate difficult and complex issues related to providing therapy. So one way in which DBT helps clients is to address and overcome core abandonment issues. So core abandonment beliefs include the following. First, abandonment with the belief all people leave. Second, mistrust of others with the belief I can't trust other people. Third is emotional deprivation with the belief I don't get the love I need. Fourth is defectiveness with the belief if people knew me, they'd reject me. Fifth is the issue of failure with the belief I'm a failure or what's the use, I'm always going to fail. So let's take a closer look at each one of these in turn. Okay, so first is abandonment with that belief all people leave. A DBT approach is to invite the client to find exceptions when people haven't left or when other people left because the client pushed them away out of a coping strategy. Next is mistrust of others. A DBT approach is to invite clients to look for times when people have helped, when people have accepted and been there when they needed them. We often tend to forget the positive and remember only the hurt. This is understandable because our brains are wired to recall pain and then work to help prevent future pain. But that leaves us hyper-focused on the pain and missing the positive moments that really are there. Next is emotional deprivation with the belief, I don't get the love that I need. A DBT approach is to invite the client to explore how effectively they communicate their wants and needs so that people can understand them and try to help. So I'll show you a little bit more about how effective communication is understood in DBT later on in this presentation. Next is defectiveness with the belief, if people knew me, they would reject me. A DBT approach is to invite the client to start by getting to know and accept themselves. And then remember that people can reject certain things, but still care about you as a person. So that's an example of one of those dialectics. Both can be true simultaneously. And last is failure with the belief, I'm a failure, or what's the use, I'm always going to fail. A DBT approach is to invite the client to make a list of all the things that they're good at, and then also viewing failure as a learning experience. Failure means you have succeeded in learning how not to do something, right? So this is a reframe, but it's also another dialectic. Both are true. It's true that you failed, and simultaneously, it's also true that you succeeded in learning what not to do. A key component of DBT is mindfulness. Put simply, mindfulness is paying attention in the present moment non-judgmentally. Mindfulness is not a one and done thing. It's a skill. All people tend to get better at what they practice, and mindfulness is a practice. As clients practice mindfulness, they're going to get increasingly more adept at paying attention in the present moment non-judgmentally. This can help clients recognize their own feelings without over-identifying with those feelings, or without allowing their feelings to consume them, and without having to act on those feelings impulsively. Mindfulness teaches that emotions and thoughts flow in and out. Negative feelings pass, or at least they lessen in their intensity over time, even a short time. Therefore, a useful skill is to learn to distract oneself until that emotion subsides. So one skill that's taught uses the acronym ACCEPTS. DBT likes acronyms, by the way. So in ACCEPTS, A stands for activities. Engage in activities that require thought and concentration. Hobbies, projects, work, school. The first C stands for contributing. Focus on something, someone or something other than yourself. Volunteer, do a good deed, do anything else that's going to contribute to a cause or the well-being of another person. The second C then stands for comparison. Look at your situation in comparison to something worse. Remember a time when you were in more pain or when someone else was going through something more difficult. E stands for emotions. Do something that's going to create a competing emotion. Feeling sad? Watch a funny movie. Feeling nervous? Listen to soothing music. And then P stands for pushing away. So do away with negative thoughts by pushing them out of your mind. Imagine writing a problem on a piece of paper, crumbling it up, and throwing it away. Refuse to think about the situation until you feel somewhat better. T stands for thoughts. When your emotions take over, try to focus on your thoughts. Count to 10, recite a poem in your head, read a book. And then S stands for sensations. Find safe physical sensations to distract you from your intense negative emotions. Maybe wear a rubber band and snap it on your wrist, or hold an ice cube in your hand, or eat something sour like a lime. So here's an example of another DBT intervention called improving the moment. Let's watch how this one works.
What I'd like to focus more on is your tolerance of those stressful moments in that time, and using that as a route to get to some of the underlying issues.
I get that.
We really can't deal with the underlying issues if we can't get to a baseline in the moment. And what I mean by that is, if you are in fight or flight, the part of your brain that actually gets activated is the primordial parts of your brain. So that's not the frontal lobe that makes good decisions and manages your emotions effectively. That's the part that's just trying to survive that moment. Mm-hmm. So we have to find a way to get you out of that fight or flight activation and bring you back to a baseline where you feel like, you know what, there's nothing wrong with this moment right now. Therefore, I don't have to activate that fight or flight. And that leaves you more room to then process the deeper issues, if that makes sense.
It does.
So with the distress tolerance, there's a couple of ways that we can work on this. One thing when you are feeling hopeless and helpless is to try to improve that moment at that very time. And so a very simple way is just to self-soothe with your 5 senses. And this just involves you ticking off for each of your senses something that is pleasant for that sense, and being able to commit to using those in under 1 minute. And I think that that's a really important part of this, which is that when you are starting to have that hopelessness or helplessness well up, that there's something that you can do to self-soothe in under 1 minute. That's simple. So what are some things that you can think of, for example, that would appeal to you visually, that would make you feel calm or relaxed? What does that involve?
Something visually?
Yeah. Like for some people, they like to look at a picture of a
Yeah,
vacation
so
spot.
I really like aquascaping,
Ah,
which is like,
okay.
it's underwater gardening.
Okay.
So I watch these videos, they're more than a minute though. I don't know if that would work because these videos are long, but it is very peaceful and soothing and calming to watch somebody garden underwater essentially. But that's not less than it's not a minute, it's much more than that. So I would just say images of my dog.
Yeah. Great.
I've never thought about looking at an image to handle depression, so I don't know.
Right. Yeah. And I think it really does show, again, how simple it can be.
Yeah.
Just in that moment, just to improve your moment by looking at something that's happy.
You know what I love looking at is real estate magazines.
Yeah.
And I was looking at
That's
one
great.
last night on my coffee table, and I thought, why don't I look at this more? This is so
Yeah.
nice. So I could do
Yeah.
that for a minute.
Awesome. Yeah. I've had people tell me things like that they want to look at a clothing catalog. I mean,
Yeah.
no judgment, whatever works for
That's
you,
right.
right?
Yeah, yeah.
So whatever brings you that sense of peace. Let's try one more sense. Like, what about like olfactory? Like things that bring you senses of relaxation and calm, like when you smell a particular fragrance or any other kind of thing that would appeal.
You know what calms me down so fast?
Uh-huh.
A clean, organized house. If I walk into my house and it's clean and organized,
Oh, isn't it nice?
yes. But
Yeah.
if it is chaotic and there's dirty laundry, like I'm gonna go home to today,
Right.
then I walk in and I go, "Ooh, gosh, this is stuff." So olfactory, it's an environment that's clean, organized, and not stressed out.
Yeah.
Because if my environment looks stressed, then I get stressed.
Yeah,
And
so
I
a
do
sense
know
of
that.
cleanliness, anything
Yeah.
that would evoke that for you.
Yeah.
Sometimes people enjoy like smelling their dryer sheet.
Yeah,
because
I wouldn't enjoy
of
that.
Yeah, because it like reminds them of a clean house.
I would just go, why am I smelling a dryer sheet if I did that? I do have a new detergent called
Yeah.
Frey, I think. It's the best. Not
Yeah.
sponsored by Frey. Only by Frey detergent.
Yeah.
So that scent does calm me down.
Okay. What about something that appeals to your taste? Some people like to, eat a mint, like chew a piece of gum, like it tends to calm them down a bit. Like, is there anything like that for you? Certain foods?
No, sushi. I like sushi.
I know, me too.
I do love Pellegrino water.
Okay.
Yeah.
Yeah.
That to me is when I was broke, when I had no money, but I was like, I need something to just make me something other than pasta and butter,
Yeah.
I would buy a bottle of Pellegrino water because it's, $1.20. But to
Yeah.
me, the joy is like $10.20.
Yes.
I think it's so good.
Absolutely.
Yeah.
I like that. Okay, great. So these are just, examples. You can think some more about it, but really it's all about self-soothing with your 5 senses for under a minute. And usually people will find that even utilizing 1 or 2 of these things, it'll change their experience in the moment enough so that they're not engaging their fight or flight and they can take a little bit more time to be more concerted about their next step.
So I have a question about that because in most of my experiences with these major episodes, I have been aware that they were coming on. And so I've actively made decisions to try to not have them happen. And it never worked. I would go see a movie, I would call a friend, I would clean my house, I would do all these things, and it seemed inevitable.
Yeah.
And now if they were to come on again, I would believe that it was inevitable.
Right.
I wouldn't believe that those things would keep it from coming. It might delay it,
Yeah.
but not keep it from coming. That's
Right.
what I believe.
Right. And I think part of this is also not rushing to have to prevent it from coming. It's a weird idea, but DBT is really about accepting the current experience.
So, another key component of DBT is helping clients improve their interpersonal effectiveness. And they can use the acronym Dear Man to learn to assertively set and maintain healthy boundaries. So, let's look at each letter of the acronym in turn. Describe the details of the situation. So rather than assuming that the other person understands the situation like you understand it, describe the details as you see them. And then E stands for express your emotions and thoughts. And this is best accomplished through the use of I statements. Then A stands for assert, by asking for what you want or by saying no. In this approach, clarity helps. So rather than beating around the proverbial bush or expecting others to sort of intuit what you might want or need, ask forthrightly. Rather than hoping that they're not going to ask you for things that you don't want to do, find the courage to say no when wanted or needed. And then R stands for reinforce, by rewarding, not punishing. We know from copious amounts of research that rewarding desired behavior has a better chance of causing that behavior to increase than punishing the undesired behavior has. The M stands for mindful, which includes staying focused on the issue at hand. Avoid attacks, distractions, and sidetracking. Instead, act like a broken record. Assert again and again and again. Then the second A stands for appear confident. Talk, walk, and act with confidence. Act as if needed. And then finally, the N stands for negotiate. Be willing to offer an alternative and be willing to ask for an alternative and turn the tables if you need to. So you can let clients know that sometimes you're not going to need to use the whole Dear Man. So an example is if a person asks you if you want to buy some street drugs, a simple no is going to suffice. You don't have to go through the whole Dear Man process. But a lot of times in relationships, it helps. Another intervention is the My Recipe Box. So the Recipe Box activity teaches the client better coping strategies during times of distress or worry. This activity helps the client identify emotions, and it teaches ways to better handle them, like emotion regulation strategies. And the client's going to come up with a recipe, which is going to consist of a coping plan. And this activity encourages the client to come up with coping strategies based on their own strengths and learn how to apply them to their own life stressors. So this activity helps the client develop an emotional understanding of the self and teaches the client how to turn a worry into a better outcome, as well as coming up with ways to better handle them. So the materials that are needed for this activity include the recipe box, note cards, pens or pencils, markers, crayons, maybe even stickers. And the procedure is as follows. So first, introduce the exercise to the client as an activity that can be used for understanding emotion. Second, instruct the client to bring their attention to themselves as well as the surroundings, like family and friends. Third, ask the client to take a few moments to identify potential stressors that they would want to work on. Fourth, identify why these would be considered stressors and discuss ways that the client can cope or work through that stressor using the note cards. 5, instruct the client to create a whole box for all the recipes with whatever media that they intend to use. And then they can decorate the box, they can make it personal to them. After the box is complete, have the client put those recipes that they created into the box. And then after the client has completed the box, invite them to reflect with some questions. So questions can include, what was this activity like for you? What was it like for you to come up with your own strategies? Why did you choose to decorate the box the way you did? What did it feel like for you to see your strengths? How can you use this box in times of distress? Okay, so another tool from the DBT toolbox is the understanding of the wise mind. And this one takes a little explaining. So let me start by saying that wise mind is one of 3 voices that we all sort of have inside our heads. The first voice, though, is worried voice. Worried voice is the one who comes up with the doubts, the what ifs, the yeah, buts. It's the voice of anxiety-provoking thoughts and feelings. It's really creative, it's imaginative, and it leaps automatically and continuously toward awful possibilities, potential catastrophes. It wants to know for sure that everything's going to be okay. It begs for reassurance. It rebels when asked to accept any uncertainty or ambiguity. Worried voice is an all or nothing thinker. It has a hard time waiting. Everything feels urgent and important in that moment. Worried voice begs for relief from anxiety. It demands attention and comfort. It wails and escalates when it feels left on its own. The second voice in our heads is false comfort. False comfort is the voice that issues reassurance at the drop of a hat at any hint of anxiety or doubts. It follows immediately after those what ifs that worried voice puts out. And the mission of false comfort is to give worried voice immediate relief from anxiety. It argues, it suppresses, it reasons with, it tries to distract from the messages of worried voice. It offers avoidance suggestions. The problem is that false comfort provides unproductive reassurance. It therefore has no staying power, and it automatically re-triggers another concern from worried voice, and that requires false comfort to step back in, and then worried voice is triggered again, and then worried voice always seems to have the last word, and anxiety goes up while tolerance for uncertainty continues to go down. And so then often what happens is that these two voices go back and forth with each other. Worried voice says, "I'm worrying that I left the stove on." And false comfort replies, "Don't be silly. Of course you turned it off. You're an extremely safe and responsible person." And then worried voice says, "Yeah, but 2 years ago I was about to leave the house and I realized that one of the burners was still on." And false comfort says, "Well, no one is perfect. Don't be so hard on yourself for once in your life." And then worried voice says, "But I might have burned the whole house down. I'd be homeless." Seriously, what do you think the chances are of that happening? That's highly unlikely, says false comfort soothingly. "But it only has to happen one time. I need to make absolutely sure that the burner is off," frets worried voice. "Well, maybe you should just leave work and check on it just to be 100% sure," soothes false comfort. Eventually, worried voice gets stronger and stronger. Okay, but last time I left work to check on it, I got in trouble. And anyway, when I got back to work, I was worried because I'd accidentally turned it back, maybe I accidentally turned it back on because I was so upset with myself. Maybe I have a terrible memory problem." Okay, so it seems clear that false comfort isn't good at getting worried voice to stop asking for more and more reassurance. In fact, worried voice actually thinks of new things to worry about in response to false comfort's efforts to help, and they're stuck together in the reassurance trap. This is the worry, reassure, worry again cycle that maintains and reinforces the trap. And when you're in it, you lose perspective and you develop emotional tunnel vision, focusing only on your goal of needing to be absolutely, positively, 100% sure. Wise mind is the third inner voice. It's able to rise above and to separate itself from the unhelpful interplay between worried voice and false comfort. Wise mind has learned that doubts are a natural production of the human mind, that some thoughts aren't worth considering or reacting to, and that nothing is going to be guaranteed. And wise mind can see that any quest for ultimate certainty is hopeless, and it produces more distress in the long run. It understands that most thoughts, even the horrible what-if thoughts, aren't danger signals. And it also understands that the mind can issue false alarms, and it knows how best to react to a probable false alarm, not with immediate urgent action, but by simply allowing time to pass. Wise mind is mindful. It knows how to observe the mind without judgment, and it doesn't get entangled in the argument that goes between worried voice and false comfort. Wise mind's ability to observe the internal dialogue in real time is an essential component of breaking out of the reassurance trap. In particular, wise mind has the ability to discern in a non-judgmental and non-critical manner the interplay between worried voice and false comfort. So wise mind takes charge and says, "Okay, give me an example of something in life that's risk-free." And both worried voice and false comfort are silent. "That's right," continues worried mind. "You can't think of anything because nothing exists that's risk-free. So why are you trying to be absolutely 100% sure that you didn't leave the stove on?" a guarantee is just simply not possible. And then worried voice speaks up and says, but I can't stand not knowing. And wise mind responds, worried voice, you have trouble seeing that you're taking your thoughts too seriously. Thoughts are just thoughts, even if their content is frightening. You tolerate not knowing, for sure, all kinds of terrible things all the time. You just had this particular thought pop up, and it freaked you out. False comfort adds, yeah, she gets so upset. I'm just trying to help. And wise mind turns now toward false comfort and responds, I understand. You think that you have to reassure her every time she brings up something to worry about. But it hasn't worked so far. So why would it work in the future? You're making her think that she just can't handle any anxiety or doubt, and you're reinforcing the idea that such thoughts are valid warnings. Let's allow one check, and then let's deal with the uncertainty that remains. In the long run, this is how you bypass all this misery. In this dialogue, wise mind has shown worried voice and false comfort a path out of the reassurance trap. This might be a difficult path involving tolerating some uncomfortable feelings, but wise mind has pointed in the right direction. Okay, so here is more on engaging that wise mind.
In the moment when you find yourself struggling with hopelessness or helplessness, the first thing to do is to spend a little bit of time, under a minute, just righting your mind again. Okay, we're not in a state of emergency. I'm able to handle this. Whatever I need to do to re-engage that, whether it's 10 deep breaths or self-soothing with the 5 senses or whatever I need to do to make sure that I can put my mind at a state that is not in fight or flight, because we don't make good decisions then, and it's hard for us to engage our wise mind. Then after that, once you realize that you've sufficiently gotten to a place of calm, then it's about introducing some of the deeper level strategies to try to manage the situation. So the first one is wise mind. It's this principle of engaging both the emotional and logical sides of you to a wise mind that actually can sort of transcend all of that. It's sort of the 1 + 1 doesn't equal 2. It's more than that. It's more than the sum of its parts. It's not just logical and emotion mind together. It's something even better where you can actually take a step back and say, here's what my emotion mind wants to do. Here's what my logical mind wants to do. But when I gather everything together and also experience that there is a deeper meaning to all of this and what we're going through, what would that part of my mind want to do next? So when you feel hopeless or helpless, I'm imagining that your emotion mind is like screaming for you to run back into bed or do whatever you need to do. And then maybe there's your logical mind that's thinking, okay, what are the things that have worked in the past? Can I apply any of them now? I should apply them now. I should get better. Why am I not better? Why is this coming back? Maybe it's also the part that yells at you and self-criticizes. So then what would your wise mind do in that experience?
You're asking me, huh?
Yes.
I don't know. I've never thought about it that way.
Yeah.
I've only tried to ignore my emotions and act on my logic. That is truly what I've tried to do.
Yes.
When my emotions like just get back in bed, I'm like, oh, I really shouldn't do that. I should do this, but I don't want to do that. And then I probably just end up getting in bed anyway. Because that's the emotion part is so strong in those moments.
Right.
I don't know. I don't know how to answer that question.
Yeah, and so emotion and logical mind often fight each other. It's that dialectic that you're talking about. The emotion mind saying, I want to get back into bed, and your logical mind saying, you lazy bum, you're not getting back into bed. You know that's going to make it worse. Why don't you do something different for a change, right? To try to motivate yourself to get out of that. And it doesn't work because you're forcing them to compete for the next step. And it's really about bringing them together, acknowledging that they both have.
I don't know how to do that.
Yeah, well, and I think that's really where DBT comes in, is like teaching you the specific strategies to engage your wise mind. So we talked about one of them already, which is sort of this idea of radical acceptance. How do we accept that moment, knowing that there's a part of you that's always going to survive it? That is one of the techniques
that I think I can do.
That is one of the techniques that your wise mind can use. Another technique is to try to improve your positive emotions in that moment. So I'm going to give you at the end of our session today a pleasant activities list.
Okay.
There's 250 activities on this list. And all I want you to commit to is to pick one of those to do every single day as a means of prevention, but also circling the ones that tend to work the best for you as you start to experiment with them, that you know can give you a more positive experience in that particular moment. And some of these activities are so quick, you can do them in like 2 minutes. And that is another wise mind decision. So it's not about I can't go to bed, or if I go to bed that means I'm lazy, beating yourself up, but it's more about what if I get in bed for half an hour, but while I'm in bed, I can do one of these pleasant activities, and that is a wise mind decision for that moment. And then after the 30-minute passes, you do the next thing and the next thing, so that you're really encountering each moment as it's happening, as opposed to, I need a grand way to solve this problem before it gets worse.
I'm always looking for the grand way.
Yeah.
Yeah.
And I think that is the logical mind. The logical mind is saying you need the grand way. You need to do something right now to fix this once and for all. And the wise mind would say, let's improve the moment. Let's find meaning in what's going on. And you'll find that over time, the more that you're able to sort of break down your experience in those pieces, the less the hopelessness and helplessness will scare you.
Yeah.
And that's really sort of the core
I get that.
of all of that.
I so understand that.
I want to thank you for your attention to this presentation that provides really just a brief overview of DBT. You can receive more training in this evidence-based approach to treating borderline personality disorder and related problems caused by complex PTSD, in addition to potentially a wealth of other things. Keep in mind, though, that to be properly following the evidence-based protocol, you'll need to be part of a group of providers all offering DBT-based individual counseling, running DBT groups, and sharing call and doing consultation. At the same time, a lot of DBT interventions have great value on their own and can be utilized with a variety of clients to help with a great diversity of problems. So I invite you to learn more and add these to your toolbox. Thanks so much.